Hello out there. This is Dr. Lamore, another podcast, another informational video or informational session here that you can always find on YouTube. Remember that these podcasts are designed as reference tools for you and your family and your loved ones to use on YouTube so that you can help yourself. Again, the greatest doctor is the doctor within you. Your body knows what it needs. You need a little guidance every once in a while, you need a little help. And I like not only going to the chiropractor and the medical doctor and all the physicians, but learning on your own, you know, a book, YouTube, pamphlets. That's whole idea of public health. The idea is to get you the information so that you can use it and make it easy. This session today, we're talking about the leaky gut. And I know this is a big term. Mitral valve prolapse in the 70s was a big term. And I think now in this generation, leaky gut solution or syndrome is the catchphrase. And it does everything from migraines to autoimmune to circulatory changes, skin changes. I mean, it covers the gamut. And I think more importantly, understanding leaky gut is understanding that the gut itself has a physical presence, a physical modality or a physical being of its own. We know that we see the skin, we can see the texture of it, we can see if it's dry, we can see if it has infections, but it's hard to see your gut. You have to be a little bit of a detective to determine whether your gut is healthy. And when the kids were little and we'd travel with them, we'd stop at a public restroom and the kids were so young, they would say, "Oh my God, it's terrible, it smells." And I'm like, "Shh, no, that's poor nutrition." And it was our little joke. And it really is. It shouldn't be so offensive, the other end of your gut, that everybody wants to run from you. So we'd travel along the way. And as the boys got older, they would come out and they go, "Oh, Dad, poor nutrition everywhere." That's a sign. It doesn't have to be just rolling in bed with your hands on your stomach or you can't move. They're little signs sometimes. And the gut is so important. The microbiomes, the whole ecosystem of bacteria and protozoans and yeast, everything that grows in your gut is so important for the immune function, the endocrine system, the nervous system. And you'll see this on YouTube in the written slides about the importance of it. In the gastrointestinal system, 90% of our happy hormone serotonin is found. One of our local doctors in Fairfax, Dr. Posner, brilliant physician, has a product, Serotabs, where he's able to lock serotonin with a fat-soluble vitamin for people who are deficient, get it into the system with it passing the brain-blood barrier because the fat-soluble vitamin that it's attached to. And one of the things that happens is people lose weight, because you're changing the whole dynamics of the gut. The gut is so important. And remember, the gut starts when you're born. Nursing moms, you cut diabetes in your children 50% from nursing. And yet when we see a mom nursing in the mall, everybody's like, "What's she doing? Why is she doing it?" Because she loves her child. When we talk about leaky gut, we talk about it when we're in our 20s and 30s, but we should realize that it started when we were first born and how we developed. Remember, people coming to me for a long time, they know my mantra in terms of 0 to 20, you grow, 20 to 30, you mature, 30 on, you start to change. And that's when the leaky gut syndrome or leaky gut symptoms start to appear, 30 on, where you get the aches and pains and the abnormal digestion, the flatulence, all the things. And all of a sudden you say, something's different. Well, for the past 30 years, you've had the American diet, that poor, sad diet of processed foods, of high fat, high fructose corn syrup, and everything from now. I mean, in the 70s, if grandma made a cookie, if you didn't eat it in a week, you could use it as a hockey puck because there was no chemicals in there. And all of that is in our intestines. And we're losing our flora in our intestines because of all the chemicals and the way we eat. So understanding that the gut itself has a physical structure, and that physical structure starts at birth. That's why it's so important for the moms to take prenatal vitamins. So when we talk about leaky gut, we're talking about the change that's happened over a long period of time. If you ask me, we should also have it leaky gut, leaky brain, because your malnutrition or a lack of absorption of all the functional nutrients that you need, in my opinion, leads to abnormal brain function later. And we can test that. The test here that we give, it's called BrainSpan. You can Google it. BrainSpan tests the nutrient density of your blood and the cognitive function on a computer test. The military has been doing it for 15 to 20 years. I think it's a great way of determining how your nutritional value is changed, whether positive or negative. It gives you a number, a specific guide or rule that you can use to try to alter. Because if you do have leaky gut, you can change it. You can make it better. Maybe not fix it all the way, but improve it. 50, 60, 80% improvement, at least. So what is leaky gut? Leaky gut is the intestinal hyperpermeability of the intestines. And so many people know that I haven't had a television in my home for a long time. I think it's a waste of time. So when I'm bored or I want some entertainment, I'll go to YouTube and I'll look at a documentary. One of the documentaries I liked was a young man who was going to travel the world. He bought a boat, nice boat, a wooden boat. And it was his whole life. He was 20 years old. He's going to start his life, and he sails across to Greece and Spain and Italy, and he's going to find his true love. And sure enough, he does. He finds his true love in this wooden boat, and they make a baby. And they're sailing around the Mediterranean, and all of a sudden, this wonderful boat that he bought, that he inspected, he thought was the greatest thing. His whole life is based on the structure of this boat. All of a sudden, he starts to see signs of change. And he's a little confused. Now, they're not big signs. They're little signs. They're little annoyances, little changes, little creaks that weren't there, little places that have changed or blemished. And so he puts into a port of call, and he finds an old guy, specialist in his field. And he says, I have this wooden boat, and I'm having issues, and I want you to diagnose me. A lot of physicians do that, and you can do it yourself. So the old guy goes through the boat, and he says, you have woodworm. And he goes, what? He says, yeah, actually in the wood, there's a little worm that's digging away at the inside like termites. And if you don't treat it, you'll be sailing around for a short period of time, but over time, the woodworm is going to change. It's going to change the integrity of the boat, and you're going to see the boat fail even further. And so the old guy says, well, you have to do something drastic. You have to change, and you have to change now. And what you have to do is you got to sail down to Antarctica. And he goes, what? Antarctica? Yes. He says, well, all we have is shorts. We'll get a couple of blankets, because you got to go to Antarctica. You got to bring that boat right down to Antarctica, and you got to freeze and kill all the worms in the boat. The worms that you don't even see. You just see the remnants of these worms. And so this guy takes his wife and the kid and one other guy. They sail down to Antarctica, and they sail around, and he comes back to Greece, and he had killed all the worms in the boat. The old guy could show him the signs where the worms had died. And he said, what you did by changing drastically your approach, you've saved that boat. And so I think sometimes when we talk about leaky gut, or gut health, we're talking about making drastic changes. And that's what it takes sometimes. Not in everybody, but in some people, when you have really severe symptoms and you don't want them to progress to autoimmune or circulatory dysfunction or dementia or alteration of mentation of your brain or changes in your blood chemistry, you have to do drastic things. And that's where we see people going on the gluten-free diet or a keto diet or a microbiotic diet. There's all different ways, all different tools you can do, but sometimes you have to take that dramatic change. You have to step forward. You have to do things that make you uncomfortable to change your body, but make it simple. Remember, I teach, God makes watermelons and God makes string beans. Just because you're larger doesn't mean you're unhealthy. And just because you're smaller doesn't mean you are healthy. There's a lot of gals who come in at 114 pounds, have the worst gut health. And I'll say, well, what are you doing? I eat right and exercise. Well, what does that mean to you? Because if they have a gluten intolerance, that's going to irritate the gut lining. If they have hyperpermeability, where the gut lining has holes in it, like the worms in that boat making holes in the boat, those holes are going to allow food to get through and the nutritions to leak out. You're not going to get the nutrient density from the nutrition that you're eating. So remember, leaky gut syndrome is something that develops over time. And leaky gut syndrome, if you look at the literature, causes a lot of things, from abnormal bowel functions all the way to autoimmune. I don't know personally. I think that it's a mixture of both. And I think we can do better than the American diet that we have. I think the American diet and the amount of pesticides and chemicals and genetically modified changes is changing our bodies so slow that you're not realizing it until later. And the leaky gut syndrome is really there. We can prove it. The protein zonulin is in your body, and it will destroy your gut lining. And we can show this. But sometimes the symptoms hide. And so what we have to do is we have to make the decision, do we go totally drastic and do the gluten-free diet? Or do we do part of the gluten-free diet? And why are we doing it? Not only just for leaky gut, but in my opinion, for leaky brain. You know, and it's hard to change. I grew up in New York eating Italian food. That's gluten everywhere. I mean, there's not a meal that goes by that gluten isn't part of it. And my wife and I will change. Now she'll give me gluten-free pasta, and with enough sauce, everything's wonderful. I mean, the sauce is great. And then I'll say, where's the bread? And I'll say to my wife, here's bread. And she'll say, you're trying to kill me. Oh, it's gluten. I forgot. Yeah. And that's the leaky brain, I tell her. You know, she has more of the leaky gut. I have more of the leaky brain. But the idea behind it is that you have to understand that changes are going to be small. She senses the gluten change more dramatically than I do. But I know that I'm healthier by doing the 80% of gluten-free diet than not doing it at all. And these are the things we want to teach you. So understanding that the leaky gut syndrome or digestion in itself starts when you're young. The whole idea of that's why moms want to nurse. You want to get the colostrum in there and start the child off at the baseline and develop that gut. No child should be eating off the children's menu. It's not even food. And so when you're eating for 20 or 30 years off of macaroni and cheese and chicken fingers and all these other things, how do you have a mature, developed gut? You can't. Then on top of that, you're having an antibiotic for ear infections. And then they fall down on the playground and they scrape their knees and they're on an antibiotic. And the antibiotics can kill the bacteria in your gut. And the literature now says that one antibiotic, it takes 12 months to replace your gut, your healthy biome. So again, we want to determine where we are at and what our symptoms are, and then make progress into changing our diet to a healthier diet. I don't care about size. I care about function. We all can say what makes us feel better or feel worse in our diet. I don't like spicy food. Another person has lactose from milk and they'll have flatulence. So you talk to the doctor, you come in, you talk to the chiropractor, and we can assess you and help you through this and make better changes. So again, leaky gut has several different prominent areas where you can change your gut lining. The American diet. Most of it's processed foods. Nobody eats real food anymore. I mean, I love when people come in and they say, I eat paleo. Good. Hunter-gatherer. You can't hunter-gather a cupcake. So if they do that 80%, they're going to have a better gut health, a better biome, right? Exposure to chemicals. Guys that do the fertilizing along, the true chem guys, I worry about them. You know, I want to see them wearing rubber gloves and rubber boots so their exposure to these harsh chemicals is lower. Chronic infections. We talked about kids with ear infections. You're developing a gut from childhood. You want a healthy biome. You don't want to have antibiotic after antibiotic after antibiotic. That's going to kill the flora in your body. So that later you have all these holes in your body and you don't get the nutrient density that you need for a healthy immune system and a healthy nervous system. Food allergies, excessive medications. Look, no medical doctor wants to hurt you. I'm convinced that all they have in their heart is goodness. But we also have to be the educated consumer too. We can't lay everything on the physician. They're doing their best. You can't fix a mechanical problem with a chemical. I can't change a diabetic, but I can help the syndromes that are associated with diabetes. The medical doctor isn't going to change that hyperpermeability of your gut with just medicines. You have to do like L-glutamine, and you have to do the anti-inflammatory diet and stay away from gluten and stay away from alcohol and caffeine. Those things can help heal the gut. Take the probiotics and prebiotics, and we'll talk about all these things that you can do to mechanically change the gut to stop the permeability of the nutrient density. So not only do you end up with a leaky gut that's fixed, but you don't end up with leaky brain. Because ultimately, when we look at the nutritional changes from my generation, I'm 30 years in practice, and we went from eating really nutrient-dense food, homegrown, no preservatives, to what we have today, and we're seeing more diabetics, more dementia. And I think this is directly tied to the gut and gut health. So leaky gut, gut health, it's all in the same thing. It's what we're talking about in terms of terminology. Again, we look at the American diet. It's a grain base, it's dairy, it's sugar. And a lot of people don't realize that artificial sugar and real sugar, your body doesn't know the difference. It's still sugar. You know, I remember when I was buying my first home, and the realtor, I was so nervous because I didn't know when and how. And she said, listen, you're going to get a mortgage. If you jump in the river here, or you wait a few months, you jump in the river there, it's still going to be cold, dude. It's the same river of life. So the idea behind it is you want to understand that gut health is determined by what you're eating, and you can eat better and you can plan. Perfect? No, you don't have to be perfect. You just have to know your body. You know, I didn't know that I had a gluten intolerance until I started feeling better because my wife had it and she dragged me into this gluten-free diet. Perfect? No. Improving? Yes. Do I feel better? Yes. The idea is I'm trying to change my gut lining so that I get the nutrient density that I need, so that I have better brain health, because as I age, I don't want to have the memory lapses. I don't want to have the shakiness. You see people at church and they're giving their tithes to the church and they're shaking as they put it in a basket. Not, in my opinion, from nerves of giving out their money. They're shaking because nutrient density is low and their nervous system is taxed. These little signs and symptoms are important, and that's what we want you to realize. So in this podcast, as a reference on YouTube, there's a lot of them. Use them, share them. Food, the whole idea of frankenfoods. I mean, our children have grown up in this whole environment of high fructose corn syrup, of processed everything. It's crazy. You know, when I was growing up, and a lot of people of my generation growing up, there was nothing processed. We would have one 32-ounce bottle of soda once a week for a family of 5. And the kids are going and drinking 2 and 3 sodas a day. Or the diabetic who's on an insulin pump and says, well, I'm having a Diet Coke. Well, that Diet Coke is the same as having a regular Coke. You shouldn't have any Coke. You shouldn't have any sugar. You've got an insulin pump. Do you want to give up your vision, or your hands, or your feet? I mean, it's that important, and it doesn't have to be that complicated. You can make better choices. Hunter-gatherer, I love, right? Paleo. Keto. I mean, a lot of people come in and say they're keto. I'm not so worried about being keto. A lot of people have issues with it. I think that the body needs fats. And so I think that you have to see where you are in your life cycle. Where can you be in terms of your nutrient density at work, that you can either bring a salad or buy a salad and not go for the McDonald's or the Burger Kings or the pizzas all the time. Doesn't mean you can't go to them. It means you just have to limit them. So we always talk here about, in the chiropractic world, about the anti-inflammatory diet. The idea of the anti-inflammatory diet is you eat a protein, carb, and a fat. 40, 30, 30. 40% protein, 30% carb, 30% fat. You need all 3. That's a healthy diet. And whatever you grow, you're going to end up with. And people coming into me will know that I say that as an adult, you should be, as a male, 10 pounds from your growth weight as a male, 20 pounds with children from the female's growth weight. You have to have parameters. Too many people are coming in, they're 20 and 30 and 40 pounds past their growth weight. And that's from poor diet. And the inflammatory diet, all carbs. The idea of having cereal for breakfast is ridiculous. Nobody should be eating cereal. That's what they use to fatten up cows and pigs and everything. They use cereals as foods. So we've got to introduce not only into a gluten-free world and a leaky gut world, we have to understand that we want healthier proteins. And you can do the vegetable-based proteins. A morning shake, a vegan shake with pea protein. That's a great way to start the breakfast. And you can do almond milk in it. There's so many ways you can get nutrient density, 40, 30, 30, 40% protein, 30% carb, 30% fat to help the gut rather than having the inflamed diet that's going to change you in terms of arthritic conditions, inflammation of the whole nervous system, inflammation of the skin, and people are breaking out. So the idea behind it is that you're eating healthier and you're eating that anti-inflammatory diet. You come in, Walker and I will discuss that anti-inflammatory. We got handouts. It doesn't have to be perfect. Eat anti-inflammatory for, half of the week. And then you can cheat a little bit on the rest of the week. There it is, gluten. God, sometimes I just like gluten. Italian bread. There's nothing better. But I limit it. That's the thing now. And the idea growing up with it, I probably had changed my dietary function because it was too much of it. I also think sometimes that when we're looking at breads today, the bread today is so processed, it's not the bread that I was eating. Because I know for a week, for sure, if that bread was a week old, you couldn't eat it. You could use it as a doorstop. You could use it as a brick. You could use it to build a house, but you couldn't eat it. It was too damn hard. Or they cut it up for croutons. Italian people don't eat croutons, but you know what I'm saying? The idea is that I think we're eating a lot of foods that are more processed than we realized. And remember, you go now, Prilosec, Prevacid, all of these protein pump inhibitors, the things that reduce gut acid because we eat such an inflammatory diet. People are going to the grocery store now. They're not even prescription anymore. It's so prevalent. They have heartburn. They're taking these anti-inflammatory meds and the protein pump inhibitors, the Zantacs, to reduce the stomach acid. But then how do you break up your food? Where do you get the nutrient density? So now you're not processing the food that you're eating. You have hyperpermeability of the membrane, leaky gut. So now you've got food just going through. You're not getting the nutrition that you need. And then all of a sudden, you end up 30 years down the road with dementia. See, it's all tied together. Now, if you need Prevacid and Prilosec and everything else, based from the medical evaluation of your medical doctor, I want you to take it. I want you to take it because you don't want Barrett's esophagus. You don't need to meet God early. The idea is you want to use common sense. You want to change your diet over time, get rid of the gluten, increase some digestive enzymes, have a catalyst to help break up the food, start to heal the permeability of the membrane. And then as you raise gut health and reduce the leaky gut syndrome, then you start to reduce the need for the Zantacs and the protein pump and the acid reducers, and so you're getting better nutrition. You're getting healthier nutrition, and you're not opening the door to disease. You won't have to worry about Barrett's esophagus or esophageal cancer because you won't have the problems that comes with the acidity from the gut lining. So we see it all works together. So understanding that gluten is part of the solution. You'll see in the writing here, zonulin, a protein found in gluten, increases the permeability of the gut by opening up the spaces of the cells. All big fancy words that don't eat gluten. Don't eat gluten half the time. Then go 3/4 of the time. Am I gluten-free? No. Do my wife wishes I was? Sure. But I forget. That's the leaky brain part. When you grow up eating Italian bread your whole life, sometimes you forget. So the idea is, I can change, and I change about 80% of the time. And so by going to the medical doctor and saying, hey, what's this leaky gut thing? Get his opinion of it, go on YouTube, come in to see me, and we'll introduce you to the idea of changing your gut health. That's what we want to do, because you'll see on the next slide, gluten really harms the body. And my God, they got a whole list. Like I said, when you talk about gluten and you talk about autoimmune and you talk about the changes, I don't know. I mean, I think it changes a lot, but I think it's based on the individual. By traveling with my boys and you go to a public restroom and you're like, whoosh, you get almost knocked over. There's a lot of poor nutrition and poor gut health. But are we paying attention to it? Are we making it important through our entire life? You know, my children were nursed right from the get-go. You know, my wife's a pediatric nurse, so that's normal for her. But she also believes in developing a healthy gut, a healthy biome. Then my children never ate off the children's menu, and their palate is pretty diverse by design. You know, I had a discussion with a couple of single moms. You know, they have 10, 11-year-olds. And I just worried about gut health and trying to educate people. And I asked a question. I said, when was the last time, to one of these gals, when was the last time your son had soup? And she said, my son doesn't eat soup. I'm like, what? Why? Well, he just doesn't. He's never had soup. And it blew my mind, because the idea is that that's the most nutrient dense thing we have in the world is soup or stews. And these kids aren't getting it. They're not exposed to it. How come? Because mom's working in DC. She's working the grind. She's coming home at 5, 6 o'clock. These kids are hungry, especially the boys. They're like, I got to eat now. Not 20 minutes from now when the soup is cold. It's not gazpacho time. I need food now. Chick-fil-A it. Let's do something. Pizza. And so they're losing not only their palate in terms of diversity, but they're losing the nutrient density that they would get from these foods. And then all of a sudden they come to me at 40 and say, I think I have leaky gut. Really? You know, the idea is that we want to look back and see. And so by adding soups, I mean, in New York, when you had, my grandmother would make escarole soup and chicken noodle soup. And I never saw tortellini with sauce on it. It was always in a soup, you know? The idea, the nutrient density was that. I didn't even know I was getting this nutrient density. So do I think my gut is totally trash? No. Do I think I'm better because my wife is making me gluten-free and dragging me to this health regime? Yes. So the idea is that you can improve by knowing a couple of tricks. And that's what we're teaching. So you avoid all these issues that are on the slide. All right, so we're at primary effects of gluten. Danger. All of the bad things. Hyperpermeability. Changing permeability of the blood-brain barrier. Dr. Posner, Ceretabs, very good product. You got any questions, come in and I'll talk to you about it. And one of the side effects of that is losing weight, which is a good thing. The effects of gluten can be severe or it can be very mild. Again, the idea behind it is you don't worry about the label like in the 70s of mitral valve prolapse. Do the good things. To understand how the body is changing through the poor gut health, and let's do something to change it so that we get a better permeability of the gut, a better density of the gut, you know, better functioning of the gut, that you don't have to have the Xantex and the Prilosec, you know. You can have a glass of wine as long as you're not on insulin, and enjoy it, you know, and monitor it. You know, I have one guy, he's on insulin and he'll have a drink, but only twice a week. Good, right? So he's learning how to moderate his sugars. And again, the more he eats gluten-free and fixes the gut, I think the less effect the sugars will have, because the gut will be healthier. You'll have these coenzymes and the vitamins that get absorbed. Again, you want to look at the basic idea of 40-30-30, 40% protein, 30% carb, 30% fat. Everything is natural as could be. Hunter-gatherer. If you can hunt it, you can gather it. That's the kind of food you want. And, you know, keto, I don't mind keto. And I also think intermittent fasting. I think we graze all day long. We're not cows. You know, they eat grass, they have milk. You want to understand that you should eat within a 10 to 11 hour period. And so if you do some of these things, the gut will start to heal itself. So you don't have the idea of diabetes or nutrient deficiencies and leading to inflammation. And again, I think that when you talk about leaky gut, you got to talk about leaky brain. Leaky brain is directly, your nutritional value is directly associated with gut health and gut performance. Remember, God makes watermelons and God makes string beans. Just because you're large, it doesn't mean you're poor. And if you grow large, you can't ungrow. I had a guy come in one day and he's coming in for an exam. We're talking. And he says, the doctor wants me to lose 140 pounds. Okay. What are you right now? 295. All right. You're a bigger fella. When you were in college, 23 years old, that's, men grow between 20 and 23 years of age, approximately. What size were you when you were 20 or 23? 280. Okay, so let's forget what the doctor said because he wants you to be 12 again because the last time you were 140 pounds less, you were 12. Dude, you can't ungrow. Nobody can ungrow. Let's take you back to the 280, eat healthy, come back when you're 59 and watch how healthy you'll be. Again, God knows what you want. You grew it. Now, if you change your gut, lap band or bariatric surgeries, those kind of things, you can change the gut and lose weight, but you're physically doing a drastic change. Like the guy going to the Antarctic and freezing and killing those worms. You made a big change. You changed your plumbing. And because you make drastic changes, you can get some phenomenal results. But I also think that you can do the basic things too for a long period of time. I think your body knows. And I think if you can communicate gut health, that I'm eating 40, 30, 30, 40% protein, 30% carb, 30% fat. I grew, 190 pounds and I'm a male and I'm less than 10 pounds from my growth weight and I'm 52 years old. Or I'm a female at 47, I had 3 kids and I'm 14 pounds from when I was 22 years of age. I think all of that, and gluten-free, all of that adds to less irritation, less inflammation. You don't have the leaky gut syndrome. You won't end up with the leaky brain and the dementias and everything else. And that's, we talk about the food, but what about the pesticides on the food? I mean, we use a vegetable wash. I see my wife washing the vegetables all the time. I think that you can do Kangen machine and you can do Kangen water to rinse an acid water that rinses all the pesticides off the vegetable before you eat them, or get the spray that's on the counter at Giant. I see it all the time. Freaking soak and spray the vegetables. I mean, they're using so many chemicals, you can reduce them. You don't have to eat all of those. And so by preparing yourself your own food, you'll know what's in it. You'll know what the goodness is there. You'll prepare the food properly by cleaning it, making sure, and that all adds to gut health. That also reduces the inflammation in your body for less arthritis. It also reduces your weight because you're not eating all the carbs. So all of it's connected. So gluten is a path to disease. Okay, I'll buy it. But it's hard too. And I'm not saying you have to buy all of it. I think we have to strive to be good, not perfection. Make better choices through the entire day, from morning to night. Making sure you do also intermittent fasting. You're eating a 10 or 11 hour day rather than grazing for 24. If you come home late like I do, then maybe you should start eating at 12 o'clock and then finish at 8 o'clock. If you're up with the birds at 5 a.m., then eat until 4 o'clock and then don't eat anything else. All of these things add up to better gut health, less inflammation, better functioning, and less disease later. That's the idea. Again, we talked about the pesticides. We all chased around the DDT truck back in the 60s. Was there chemical changes in our bodies? Probably. Are we all aware of it? No. We also, most of the guys who grew up in New York had asbestos in the ceilings, and we're not a whole country of mesothelioma victims either. Are there some? Absolutely. So I think there's also a susceptibility to your body. I think what you have to do is reduce the exposure to as many things possible. Do I think my pesticide ingestion was low growing up? I do, because my grandmother always peeled and washed everything. You know, being Italian, everything was cooked from scratch. It was from the garden. It was from the vegetable guy. Things were more healthier. Things were done. We did soups and stews and a very diverse palate. So I think my exposure was lower. I think today's environment, where you get some of these fruits and vegetables from Chile, I think they have to do a lot to them. So I think we have to know back to the farm to table kind of things. I think that's a good thing. I don't think you have to be, like I said, perfect, but farm to table, and then doing some understanding about 40, 30, 30 and making the palate more diverse. I think that's a great thing. And that's how you avoid these items. Again, no more drugs. I'm not anti-doctor. I'm anti-stupidity. Do I think everybody needs an antibiotic? No. And I think it behooves the educated consumer to, when you go to the doctor, he says, you really don't need an antibiotic, say, okay, thank you. You got value there. You paid for him to say, you're okay. Thank God. You can die. So many people die of an infection that don't even realize they have it. Approximately like 12,000 people die for tooth infection that they didn't know what they have. So the idea behind it is that you don't need all the drugs, but listen to the doctors. There's no doctor out there trying to kill people. You know, that's ridiculous in my opinion. But you can't fix physical problem with a chemical problem. So if you have hyperpermeability of the gut lining and you have malabsorption syndromes of the gut, you're not going to fix that with a pill. Now, we can talk about L-glutamine, and we can talk about nutrient density of vitamins that will help reduce that. Absolutely. We'll talk about prebiotics and postbiotics and bacteria to help restore the microbiomes or the flora of your gut. That also improves immune function. We're all in COVID land now. You get immune function from your brain and your gut. So not only are you helping your brain and helping your immune function, you're also being healthier, and then you don't have to worry about the diseases, the COVIDs and the flus and everything else. It's all connected. And like I said, we're not striving for perfection. We're understanding that you can communicate to the doctor, hey, I got up at 12 and I ate 10 hours. That was it. I had 40, 30, 30 for 3 meals. My snack was washed vegetables or washed fruits. So my boat that I'm flying and living with my life is sailing well into the 80s, 90s, and 100s. I don't believe just as we age, we get old and infirmed. I think that's ridiculous. I think that's something that's an American thing, like the diet. They accept a poor diet. They accept poor health as they age. And I think that's wrong. I think we can do better. And I tell you that nutrients and supplementation with nutrients is so viable. Everybody who comes in my office, we always talk about blue eyes, that they're on ARADs too. That's been out for 30 or 40 years. It's a vitamin regime to help with blue-eyed people so they keep their vision. That is direct evidence that supplementation affects function. Blue eyes are weaker, they're recessives, you get macular degeneration and cataracts. You can limit that by taking supplements. You can limit disease by understanding we can fertilize the body, we can fertilize the gut by taking a probiotic. You put it on your nightstand. You come in, I'll show you what a probiotic is. You put it on your nightstand, you take it at night, you don't feel it, but it does good things. That's the advantage. And you can go to the doctor and say, listen, I might have leaky gut, but I'm taking probiotics. I might have leaky gut, but I'm taking my vitamin D. I think I have leaky gut, but I'm not eating gluten for the most of the time. That's how you get well. And that turns the leaky gut syndrome off and saves your brain and saves you from the arthritis in your joints. Here we are. The important things. You can read them. All about IgAs and tight junctions. It's all medical stuff because you just want to have a healthy gut. And there are physical components to this gut. That's why I'm saying you can't get it from a pill. You have to understand it. You have to. That's why colostrum is so important for these kids. You know, you don't need colostrum when you're 25. You need it when you're 5 months old. That's the advantage of it. You know, 0 to 20 you grow, 20 to 30 you mature, 30 on you start to change. I used to say die, but everybody got offended. We all gonna die, but you don't have to go like off a cliff. You can glide gently out there. My great grandmother had 15 children, Carmela Lucia. She lived to 106, and she ate healthily. She had a diverse palate. The idea is she did it not by design, by what cultural things said. They didn't have all the processed foods. They didn't have refrigeration like we do today. They didn't have a crazy lifestyle, you know, and other crazy things. 15 children is crazy, but that's beside the point. Anyway, the idea is they had the growth of a healthy gut, and then they lasted longer, and they didn't have the dementia and the diabetes and all the other things we have. So this is that important. Do you need to learn about the IgAs and the tight junctions? No, trust me, it's important. I'll take care of that part. You come in and say, I'm gluten-free 80% of the time. Great. I took my probiotics. I took my digestive enzymes. And by the way, can I have L-glutamine again? Because I'm doing a course. Supplementation, I like the Chinese way. When you go to an acupuncturist, he's going to give you a course of supplementation. He's going to give you some herbs and supplements for a short period of time to improve the function of the tissue. That's L-glutamine. If you're going to do a liver detox, I like milk thistle. It's 200 years old. You look at any book. You have a fatty liver, detox it with milk thistle. Come on in. We'll talk about it. Google it. Look on YouTube. Come in and discuss it. Go to the medical doctor. They know it just as much as I know it. They're good guys too. We all work for you. You have to take the role of the educated consumer and communicate effectively to me what you're doing so I can better assess you. Just like the guy with the boat who saw a few little signs. He went to the old guy and the old guy helped him out. Now, do you have to do the drastic move? Maybe. But if you did small moves over a long period of time, I think it evens out, personally. So the beginning of functional treatment. Everybody's talking about functional medicine. I think it's common sense. You go to a doctor, you pay a lot of money, and he assesses you and tells you, don't drink milk with lactose in it. Take lactate, or take lactate-free milk. It doesn't have to be that complicated. You come in and see me here at Lamore Chiropractic, and we're going to talk about the nutrient density of your diet. We're going to talk about supplementation. The whole idea why I'm doing these little podcasts is a resource for people, because they come in and they go, I think I have leaky gut. Why do you think that? Well, because I don't have a bowel movement but once a month. You got a problem, you know? So the idea is we can fix some of these things. And I always say to people, don't trust me. Use me as a resource. Google me. Repairing it mechanically by eating the nutrient density foods that will help restore it. Remove the bad foods. Self-explanatory. We eat enough crap anyway, you know. The idea is that we want to add some goodness. And again, 40, 30, 30, 40% protein, 30% carbs, 30% fat. And again, don't get hung up on size. God makes watermelons, God makes string beans. Just because you're larger or smaller doesn't mean a hoot to me. The idea is function. How are you feeling, you know? If you're not having a bowel movement in 3 days, or you're doing little bunny balls like a lot of these women, there's something wrong with your digestion. And we can talk about it. We could do L-glutamine. We can do a probiotic. We can do a digestive enzyme. We can change for a short period of time. Maybe you need to go vegetarian for a month, just a month. Vegetable, vegetable, vegetable for 1 month. And then all of a sudden you say, you come back after a month of eating just vegetables and you go, oh, this changed. And then we can assess it. And I said, all right, now introduce this or introduce that. I also believe that no fruit over 40. That's God's candy. And as our A1Cs go up and as our bellies get bigger, you don't need more sugar, whether it's God's sugar or man-made sugar or any sugar. I say, if you want something sweet, stick your finger in your mouth and suck. The idea behind it is that you have to understand the idea of nutrient density foods, where your body is in the growth cycle, and what am I doing to produce a better gut? Because a better gut is a better immune system. A better gut is a better brain. And then you don't have to worry about having a caregiver at the end for putting on your britches. Okay, so now we're repair, restore, and replace. Again, I like biotic supplementation. I think we're not getting the nutrient density from our foods because it's all processed. You've seen it in the slides. You guys read like I do. Everything's processed. So the idea behind it is we have to get back to the basics, and you don't have to go perfection. A little bit at a time. And in the meantime, use a probiotic, use a digestive enzyme, and take L-glutamine when you need it in a course like Chinese acupuncture to help restore the gut. Biotics, a lot of companies have it. I just like Biotics. They help us with these slides. They have a gut restore. Do it once a year. Do it twice a year. I don't want you to do it every month. Nobody should be doing everything every month all the time. Now, there are some things. I think back in the day, we got a tablespoon of olive oil, and I think a lot of kids got olive oil and cod liver oil. Thank God my grandmother was Italian. We had the olive oil. But I think fish oil, vitamin C, vitamin D, resveratrol as we age, that's a great skin extract. All of these add to a nutrient density to try to repair the damage we did before. So there are some things that I recommend on a daily basis. But there's also a lot of things like L-glutamine you do in a course, in a 2 or 3 month max course to help restore gut health. And you come in, we discuss L-glutamine, I'll show it to you. You want to see the probiotic I use? I'll show it to you. You want to see the digestive enzyme Walker use? He'll show you that. We're here to help. We also want you to use this as a resource and share it with everybody that you know so that you can get progress, not perfection. You know, yes, do I go to Kilroy's and like their buffet? Absolutely. But I only do it like 4 times a year because it's not good for me. And so I limit it. And so if I do really good, I'm going to see it in my A1C. I'm going to see it in my fasting glucose. I'm going to see it in my LDL and HDL, right? And I'm going to be able, as the educated consumer, to talk to my doctor. For example, I had a patient come in and she said, my cholesterol is 210 and the doctor wants to put me on a statin drug. I'm like, okay, what's the HDL and what is the LDL numbers? Because just because you're 210 doesn't mean you're out of range. You know, the old adage was 200 or below. You make HDL 50 and LDL 150, that's the 200. Well, this woman had an 85 HDL. Well, of course she's going to be over 200 because the good cholesterol is way good because she was exercising. Why would you put that woman on a statin drug? It doesn't make sense. not to argue with the doctor, say to the doctor, hey, I talked to the chiropractor. He told me about 200 or below was the gold standard. I don't have any history of cardiovascular disease in my family. I eat protein, carb, and fat. Most of it's processed. I mean, most of it's non-processed, paleo, hunter-gatherer. And I think my HDL is above the norm. So why would I want to change it? Because I think my body's functioning fairly well. And then if you want to even go further, you come to me and I'll say, okay, why don't we do a carotid Doppler and see if you have even plaque? Because the whole idea of a statin drug is to reduce plaque that's in the vascular system that you might not know. Why don't we look? I mean, I do it all the time. No plaque, no problem. So why would you take a statin drug? See, this is the educated consumer, but it all ties into your gut too. See, and the gut and the brain and the blood, all of it's together. So leaky gut, leaky brain. The idea is you're doing basics. Progress, not perfection. God makes watermelons, God makes string beans. So we're not talking about size, we're talking about function. That's the key to this whole podcast. Supplementation. Now, when kids are not eating soup, which is totally ridiculous, the most nutrient-dense things we have, then you have to supplement. You know, that's when you understand the probiotics, the prebiotics, the digestive enzymes, fiber, collagen, turmeric, L-glutamine, quercetin. All of these have a role. All of these have a role at specific times. I wouldn't use L-glutamine on a 12-year-old. I would take him for pond water, pho. You know, when you take a 12-year-old and you say you're going to have soup, you're like, he's going to go, no, it's too hot, forget about it, I'm not eating, I want Chick-fil-A. So you got to say, we're going to go for pond water, pho. Everything that's in that pho is in a pond. You got frog legs, you got grass, you got water, and it's all brown, just to eat the pond water. That's how you get the nutrient density for a 12-year-old boy. He doesn't care about anything other than eating frog legs. So the idea is you can turn nutrition into fun too. And then depending on the age or where you are in that growth cycle, we could talk about some of these things. I think just taking a probiotic at night is the bomb. You're seeding for the next day, you're seeding your gut, you're helping your immune system. I mean, you do a vitamin C, a probiotic, and a vitamin D before bed or an hour before bed, so you don't have any indigestion from the vitamin C, a little acidic. You're going to have a better health and a better month than anybody else. It doesn't have to be so complicated, you know? And I think you also have to look at the supplementation. I think there's a wide variety of there. I stick with biotics research because it's time tested. I'm licensed as a chiropractor and an active license in New York, Virginia, and Florida. I keep my nursing license active, and I'm behind biotics because of their literature, because of their research, resources. They're time tested. They've been tested in court. It's quality. There are other quality products out there. Gundry, I like him too. He's got some good products. He's got a good Thrive. It's a combination product. So, and I think you can try different products during the year. Try his one for 6 months and try another one for 6 months. But be communicative in why you're doing it, not just because you went to Costco and it's cheap. I mean, you can do that too, but it's not the best value. And then that's what you're looking for. You're looking to reduce the effects of leaky gut and changing the physical permeability of the body so that your immune function is higher, so that you don't have to worry about COVID. So you don't have the other things, even just the flu. So again, come in, we'll talk about these things. Or when you come in for a visit, say, hey, let me tell you about probiotics. And I like to hear. I'm always learning. I'm always learning from my patients, and I'm always learning from seminars. Again, it's an interaction. I work for you. Every doctor works for you. They should be able to communicate effectively the reason they're doing this, why they're doing it, and what is it for. And then you make the decision. But I think some of the decisions are easy. I think having a bottle next to your nightstand of a probiotic at least is the best thing you'll ever do for yourself. And then saying to yourself on a menu, they have a gluten-free, I'm going to try it. I might not like it, but I might. And then if you have gluten-free 8 out of the 10 times you went out to eat, you've done something to change the leaky gut syndrome. See, Not complicated, educated. Maintenance. I hate that word. Because if maintenance was true, I'd be 21. Trust me. I did a lot better at 21 than now. But there's certain things you have to do, part of growing up, part of living, you know. I do truly believe in understanding the timeline of life. 0 to 20, 20 to 30, 30 on. I don't believe in that as we age, we have to decline. I watched my great-grandmother live to 100 by herself, and it was only after a bowling alley blew up that she got scared that she wanted some assistance. But was 106 when she passed with 15 children. 9 were still alive. Oh my gosh. Why are we hitting just 60? It's crazy. And the idea behind it is it's gut health, and it's what you develop and what you're doing. So it's an understanding of the little steps that I can do. And if you go to Chick-fil-A and you have to do these kind of things, if you do some supplementation at night, fish oils, probiotic, digestive enzymes with the Chick-fil-A, and you're taking the vitamin C and the vitamin D and all these other things, you're still going to come out better. And you can do it at your pace. It doesn't have to be perfect. Progress, not perfection. That's the whole key of this whole thing. So what we try to do here is educate you. 30 years in practice. I've seen it all. I've done it all. I think there's a lot of good doctors out there. I think we're not educated as consumers. And our expectations are too low for ourselves as well as our physicians. I think we have to raise the bar for us and our physicians. All of us should be able to talk about physical, chemical, and surgical. Not that I can do surgery, but I know if you're out of my physical realm and a surgical realm, you're going there. And people know when they come to me, I know my boundaries. And I like physical. I like the idea of understanding form and function and being 60 years old and not hurting. And 60 years old and understanding that my HDL and my LDL is in balance and what those balances are. Or that I have nitric oxide because I'm taking a supplement because I've measured my nitric oxide levels off of test strips that I got on Amazon. And nitric oxide is a supplement that not only do you need for your gut, but you need for your brain, you need for your blood, that you can change directly with supplementation, like ARADS 2 with blue-eyed people. When people say, well, I don't need supplements, okay, tell me what you're doing that you don't need it, because I'm sure I can find reasons you should take it. Now, if you want to live to 30, 40, and 50 and have a poor quality of life, well, mazel tov. Some people don't care. Okay, I can accept that. If you tell me you don't care about the quality of your life and you just want to live and wallow in pity, fine. I'm not going to be that person. I don't expect to get old and infirmed. No. Do I expect to have bumps in the road? Yes. Do I monitor my blood levels of certain things? Absolutely. Do I test for things and make better choices? Yes. Because I'm not going to be accused of trying to hurt my wife by feeding her Italian bread, which I think is wonderful. And I made a mistake because I forgot it was gluten. I don't see gluten. I see Italian bread. That's what I see. And so I'm making better changes over time so that when I'm 106, I'm still being able to wash myself and have a conversation and be healthy. That's the goal of this whole thing. So leaky gut, leaky brain. You've got all the resources on here. Don't make it complicated. Understand that there's a permeability to the membrane that might have developed that you didn't know over a long period of time, that once you realize that you might have it through talking with us, then you can fix it. Come in. We'll introduce you to some of the products. We'll do whatever it takes to make you healthy. And that's what we strive here. We work for you, and we want you to be happy and healthy and live the best life possible over the age of 100. God bless. Have a wonderful evening, and stay tuned for next 2 weeks for the next podcast with Dr. Lamore.